A few weeks ago, my first son, who's 20 years old, fell sick and had to be taken to the hospital. The doctors conducted some tests and I was given a diagnosis that he had renal kidney failure stage 5. What this meant is that he needed dialysis treatment immediately. As I sat there in the doctor's office crying upon hearing that news, the doctor indicated to me that the diagnosis was not the problem, but that the treatment for my son was what was the problem. By that he meant that there are no machines available for dialysis treatment, neither at St. Jude's Hospital nor at Victoria Hospital. And so what we're now left with is, currently there is a list of over 150 people who are waiting for dialysis treatment, and my son has now been added to the list. And so our only hope right now is that either somebody who's currently using the machine passes on, or we get a miracle from God, or maybe we're well connected to the government and we can go overseas to get some treatment. But this is what hundreds of families of St. Lucians are currently going through right now. We have a lot of persons who are on a so-called death list, and we have no treatment for these people. And so as I listened to Minister Alvina Reynolds speaking with reference to a diabetic research center, it more or less solidified the position that we have taken over the last couple of months, that the minister has no idea what is happening with reference to the health sector, and if she does, she is not prioritizing what should be priority. A few months ago, we had a lavish ceremony to name the new national hospital, and at that hospital there is a dialysis treatment center that was certified uncompleted in May of 2013. The water treatment plant for that dialysis center, the electrical and the plumbing, all of these have been completed. What is missing for the treatment center are the 11 seating stations and the 11 machines that can be connected to the patients for the treatment. And the EU has funds available for those. And so I wish to ask the question, whether the priority of the government should have been in spending all that money to have a naming ceremony, or should they not have spent that money in commissioning the dialysis treatment center to ensure that more persons can get treatment at the new national hospital. I went on the website of the International Diabetic Federation, of which Mr. Felipe Halban is a consultant to, and I saw that most of the research that is required into diabetic has already been done. And so I wish to ask the question, what is the priority of this government? Why are we spending thousands and millions of dollars for consultancy fee, for housing, for transportation of those persons, whereas these monies should be spent into going into the treatment for dialysis for persons who are on the waiting list for dialysis? Those 11 machines at the new national hospital, if persons get an average treatment of at least 3 hours a day, we can have 44 persons who can get treatment per day at that treatment center. And so the question that I really want to ask Minister Reynolds is, what exactly is your priority? Is our priority into researching what has already been researched and what has been done, or is our priority ensuring that our St. Lucian people who are on that death list get treatment?